This is a WNY News Now special report. I'm Justin Gould. Chautauqua County health officials and County Executive PJ Wendell are providing a COVID-19 press conference update following a spike in cases related to Fieldbrook Foods in the county and SUNY Fredonia. Here's an updated look at the COVID-19 case map. Now, this number will likely change as officials are expected to provide an update on the new cases that were reported today. Chautauqua County Executive PJ Wendell now speaking live via a Facebook live stream provided by Chautauqua County government. Let's listen in.
37 new cases. That would bring our total of active cases to 166 here in Chautauqua County. Today we have 15 new cases to announce, including 5 students from SUNY Fredonia. Of the 173 active cases who continue to recover in Chautauqua County, Fieldbrook Foods have 58 employees who tested positive and 21 close contacts. SUNY Fredonia's case total is now 50 students. Today we also have 630 individuals under quarantine or isolation orders and continue to be monitored, and we have 114 individuals under the domestic traveler quarantine for having arrived to Chautauqua County from a state listed on the New York State Travel Advisory. We also, as of the 2nd of September, have 5 individuals hospitalized in Chautauqua County with a diagnosis of COVID-19. To date, there have been 311 recovered cases. We've had 10 fatalities, and that has been an increase since our last press conference. We did have 1 fatality. That individual was hospitalized outside of Chautauqua County and been hospitalized since the end of July. We've also had 494 total cases in Chautauqua County and 35,482 tests returned to Chautauqua County as negative for the COVID-19 virus. Following the discussion at last week's press conference about weekend updates, we will begin sending a basic update on Saturday and Sunday, again to announce the new cases only. Full updates to the other statistics we will continue to provide, and those will occur Monday through Friday. As our county has seen a prevalence of COVID-19 and our numbers rise over the last week, we have seen this primarily due to local cluster of cases, most notably our cases at Fieldbrook Foods, and now we're seeing another cluster identified to SUNY Fredonia. SUNY Fredonia's total is up to 50 confirmed cases. College officials continue to work with our health department as well as SUNY officials, which is a state-run agency. A number of these cases were identified in part due to the rapid response testing that was available in Dunkirk last Saturday through Wednesday. I stated also in last week's press conference that I would be requesting the state to leave or loan some of the rapid testing machines to Western New York for continued strategic use in our response efforts. I am happy to announce yesterday that Governor Cuomo confirmed Chautauqua County will be receiving 4 of those machines and a supply of test materials to the tune of 1,000 tests. My COVID response team has established a local rapid response plan. We've teamed up with the Chautauqua Center, our local FQHC, as they have locations in both the northern and southern part of the county and have been instrumental in developing this plan with Chautauqua County. They've been assisting with our testing efforts from the very beginning, and we can't thank enough. We have Mike Pease, the CEO of the Chautauqua Center, with us today. But that group has been instrumental in our testing capabilities from the very beginning. These tests will be strategically used as potential clusters are identified. Oversight of the Chautauqua County Health Department will be in partnership with the Chautauqua Center. We also have to continue to receive and follow up with reports of businesses and individuals who are violating the state regulations and pause restrictions. I want to remind everyone, please submit all reports through the New York Pause Enforcement Task Force hotline. We occasionally receive reports through other means, but reporting them through the pause system is important to get the situation on record with the state of New York. Every pause complaint for Chautauqua County is sent directly to myself and Sheriff James Quattrone. Each of these complaints is followed up on, and that follow-up has included educational warnings, cancellations of events, and in a few instances, we've issued cease and desist orders, and businesses have been closed. If you need to make a report, you may do so by calling 818-333-789-0470 or by going online to coronavirus.health.ny new-york-state-pause. Scrolling down to file a complaint and clicking the link there. And last, I want to touch on, especially going into the Labor Day holiday this weekend, and there's a responsibility we all have slowing this outbreak and stopping the spread of COVID-19. Much of the uptick across Western New York, and this has been seen in all 5 counties of our Western New York region, can be attributed to a relaxing of our diligence in following through the executive orders and practicing disease prevention and efforts. I can tell you the disease is here. This is a dire concern we have in Chautauqua County. We can't make any qualms about it. This is something we all need to be part of. We need the same vigilance September 4th that we had in April 4th and May 4th and every other month that we've been involved in this COVID crisis. This is important. This is a matter of health and safety to all of our residents. So we can't make any qualms that this isn't here. This is some other, nothing more than it's here. These numbers are dire and we need to focus on what we are doing. Though we've been in phase 4 for 2 months now, it does not mean that we are back to life as it was prior to March 15th. We can slow the spread if we all practice the same measures we did earlier. And we have shown and demonstrated that people in Western New York, especially Chautauqua County, can keep these numbers low, following the guidance that was issued. I urge everyone, I want to see those people that were here to get us to phase 1 and phase 2 and the outdoor eating and phase 3 and now to phase 4. Those are the people we need to step up, and many of you are doing that. If you question yourself, do more. Do a little bit more and be more disciplined. To the end of the day, you can say, I did a little bit more to help this cause. A reminder we gave months ago is taking precautions and slowing the spread are important. This to our most vulnerable individuals in our community. This includes the elderly, those at a higher risk due to medical conditions. And we know there are many people, no matter their age, they could be young and have significant medical issues, as well as the elderly. So it's imperative we all do what we can to help out. We ask everybody to enjoy the Labor Day weekend. Do so safely and responsibly. Avoid a large family barbecue or a party to celebrate. Stay home with your immediate family. We're all in this together. We can get through it by exercising discipline and care for our neighbors. At this time, I want to turn it over to our Public Health Director, Christine Schuyler.
Thank you, County Executive Wendell. Just in addition to the data, the numbers that the County Executive shared with everyone, I wanted to let you know of some increased efforts that we have been taking in response to the Philbrook Foods outbreak. On September 2nd, 2 members of my staff, along with a staff member of the New York State Department of Health Regional Office and New York State Ag and Markets, did a walkthrough inspection of the Philbrook Foods facility. At that time, our real purpose there was to observe safety precautions that were in place, to see what the plant has been doing, and make recommendations for any improvements and additional measures that we found on our way. I can tell you that in general, Philbrook Foods was doing a very good job of implementing all of the preventive guidance that has come out. Staff did identify some areas of some vulnerable places where we really recommended some improvements be made. Those were really mainly around common areas, break times, and other areas where employees were apt to be congested or congregate. Philbrook Foods was very receptive to all of our recommendations. They actually have already immediately started implementing those recommendations. So we feel very confident that in collaboration with all of these state agencies, we have even worked to even improve the safety precautions that were in place at Philbrook Foods. Anyone who continues to have concerns is encouraged to continue to notify us of that. We have seen a downturn in the number of cases coming in from Philbrook, which is a really good sign that precautionary measures are working, and that not just the administration of Philbrook, but also the employees are taking the steps necessary and taking this outbreak seriously, and also minding the precautions outside of the workplace, which we truly appreciate. I can do no more other than reiterate what County Executive Wendell said. We are coming into Labor Day weekend. I am just really hopeful that if you do nothing but worry about your own health and that of your loved ones and your own actions and what you can do to protect yourself and those you love, then you should do the right things this weekend and not get us into further predicaments with large clusters and large outbreaks that really, truly could be prevented. Thank you.
Okay. At this time, we'll get into our question and answer period. We're going to take a different approach. We're going to start from the bottom, so we'll go out to WRFA, Jason Sample.
Yes, good afternoon. Thanks again for holding this update. I just had one quick question, and that was involving the data that is provided on a daily basis or even a weekly basis. I know that at the start of this week, the county did provide additional information regarding specific communities and the rate of cases per 10,000 residents. I was curious to know if that's going to continue in the communities where it's especially hit hard, whether it be Dunkirk, Fredonia, and I know that data was provided for Jamestown as well. Will we see that kind of information provided again in the future?
Anytime where we have enough cases where the volume is high enough that we feel that it can be revealed without having to worry about patients being able to or residents being able to be identified, then we will do that. And the numbers had gotten high enough in those areas where we felt it was important to release that, but also we were not endangering the confidentiality of any particular person or group.
All right, and just a follow-up to what you had mentioned earlier, Ms. Schuyler, the numbers look like they're going down for Fieldbrook Farms. It looked like the numbers reported this morning for SUNY Fredonia were a little bit lower in terms of new cases compared to what we've seen the past few days. Does that give an indication that the campus is getting a handle on this and the students are doing what they can to mitigate the spread?
I hope so. I think that's very hard to say. I do believe that the student body has received the same message now from multiple people, multiple ways and forms. I think it only natural that when the students first arrived on campus, that is a time of excitement for a lot of our young people, and also a sense of being invincible. I think to see that this virus is actually out there and circulating and very contagious, I'm hopeful has scared them enough that they're realizing they need to take this seriously and that it truly will impact the future of their college life, at least for this semester and this year, if precautions aren't taken the right way. So I do hope so.
Okay, that's all for me. Thank you.
Thank you. Moving on, Western New York News Now, Justin Gould.
Good afternoon. Does the spike concern you that you could fall back again in the reopening process? And as for SUNY Fredonia, on that part, I know the governor has said if cases reach 100, the school could have to shift to all virtual. Is that also on your radar?
Well, yeah, the number for virtual for the schools has been out for well over a week now. That was established early on. It's 5% of the student population or 100 cases. So that's been there for a while. As far as the rollback from our reopening, people have to, like I said earlier, we've been open in phase 4 since June 30th. So our reopening has been here, and we were demonstrating very evidently that we could do this in a responsible manner. In some instances, I believe we become lax and we become complacent with the numbers. And our numbers have been low. But what we need to remember is, even though the numbers are low, we need to continue what we're doing. If you're successful in business, you're not going to change your tactic and go another route because, I've been doing okay. So most people stick with what's working, and we need to get back to that here in Chautauqua County. What's working is following our mitigation, following our social distancing, wearing the masks. That hasn't changed. When we go out in masks, I'm sure everyone could tell you, personally, I have 3 in almost every vehicle. And I make sure that we have the masks. Those are the very least we can do. but avoiding large group gatherings. We've had people send pause complaints that I was invited to a wedding and I'm not going. Those are the things that we need people to do. I apologize if you selected 2020 for your wedding date and haven't been able to have it. But 1 year or one moment in time to give up and have a little bit of discipline will pay dividends for the rest of your life. So we ask everybody again, these are all on our radar, Justin, without a doubt. But we have demonstrated, the residents of this county, that we can do this the right way. We need to focus a little bit more discipline, and we will continue to be successful and remaining the health and safety first of our residents.
Okay, thank you. And for my second question, I want to talk about false positives. We've seen other places coming in issue. Is that a concern here? And how do you know if you get a result like that?
False positives.
We don't think locally we've had a big issue with false positives. That the technology that is being used by some groups, such as the NFL, and that has not been used here. Depending on the device and that being used, the research has shown where you can get more of the false positives, and then people do have to be retested. But we really have not seen that in our county yet.
Just to touch on that, a positive, whether it's a false positive or not, the best thing, if we find out it's a false positive, quarantine, isolate yourself for 2 weeks. That way you limit the risk of spreading whether you have it or not. False positives or not, we still need to take these precautions. And if you feel you're ill and it comes back test positive, take the precaution as necessary to protect yourself and others. Okay, moving on. All right, WKVW, Channel 7. No one? Okay. All right, moving on. WIVB, Sarah.
Hi, thank you for taking my question. So multiple people have reached out to us saying that there were COVID parties going on involving students from SUNY Fredonia, where the goal is to get people infected. Is there any evidence to that, and what is being done to address the large gatherings that may be taking place at SUNY Fredonia?
Well, I can tell you that nothing that specific has surfaced as factual. We do know that there have been large gatherings. We know there have been smaller gatherings where students have been congregating. We are working as a health department under our purview as far as bars and restaurants, and we're working with the Chautauqua County Sheriff's Office as well as the campus security and the Fredonia Police to ensure that any knowledge that we get of any gatherings will be addressed. With the law enforcement will be going out, and we will be breaking up gatherings. I can tell you that bars and restaurants, their health department permit as well as their liquor license is on the line. We will not hesitate to shut down operations if the establishment is not following the guidance that was out there, put out there by the state in order for them to even be open.
Okay, thank you.
Mm-hmm. All right, moving on. WDOE, Dave Rowley.
Well, good afternoon, everyone. How will the county be using these rapid testing machines? Is there kind of a plan in place on what type of cases will be utilizing these machines?
Well, keeping in mind that we just learned yesterday that these machines were coming, and the Wadsworth lab, the state health department's laboratory, just learned of it yesterday as well. So we have already began developing a plan in conjunction with the Chautauqua Center as our federally qualified health center, so that we will have the staffing and resources necessary to be able to do widespread testing in the case of an additional outbreak or a cluster where we really think that rapid technology is what is needed. The loaning of the machines on the part of the state is welcomed, and we do appreciate that. There are also some hoops that go along with that. There are some regulatory considerations, some additional licensing that we have to do, and some other things we have to do with Wadsworth in getting those machines and the supplies that go with them. So it's not as easy as just here's your machine and go do your testing. A little bit more complicated than that, as was to be expected from the state. So we are working actively on that, and hope to be able to deploy them both in throughout the county in targeted areas where we as a health department discern that the need for rapid testing is there.
Also, wanted to get your thoughts with the reopening of many of the area schools coming up next week. Have you been in touch, and your department, have you been in touch with local school districts, and do you feel prepared as schools begin to reopen?
We have been in regular communication with the school districts in Chautauqua County and with our BOCES. We have developed several resource materials for the schools to utilize. One of my public health nurses is designated as the contact for all school health nurses, so they are in very regular communication. We, as far as local health departments and schools, have been promised updated clinical guidance from the state for quite some time now. I am told that it should be coming maybe today or over the weekend. So if there are any changes that need to be made to the guidance that we have already put out there for schools, then we'll do so as quickly as possible. We will have a link is on the county's COVID page on our website that has all of these resources, so they are there also for parents to be able to see, including as soon as I can get back to the office and get this done, a nice flow chart that really explain when kids can go to school and can't go to school, and how the screening process works, and our testing recommendations as well that go with that. So we are hoping that those resources are very helpful to our school districts, and this is absolutely a partnership between us and the school districts. We don't know what to expect. I honestly fully expect we are going to see cases, because it's impossible when people start to congregate more that this is what's going to happen. We know the virus is in our community. Our goal is to keep everybody as healthy as we possibly can.
Okay, Christine, PJ, thank you both.
You're very
Thanks,
welcome.
Dave.
At this time, Mike, did you want to say anything as far as the partnership we have with Chautauqua Center?
No, I would just echo what's already been said. We look forward to working closely with the county. We're developing a plan. We'll take our lead from them in instances where we do need to do rapid testing. But I would also like to remind everybody there are organizations that are doing general testing out there now, and if you feel like you need to be tested, you should absolutely be reaching out. We're one of them. The hospitals are testing. Urgent care centers are testing. So we saw a huge number of folks get tested during the rapid testing, but if you look at normal tests that are being, on a normal day, the numbers are significantly lower. So I don't know if it's a lack of people not understanding that there's testing available, but it's certainly out there today.
Excellent. Thank you. Okay, Mark Goshgarian from Spectrum News.
Thank you. I just wanted to, Chris, piggyback on the Fredonia thing. Just a lot of questions I have already been answered, but this is the second cluster. We had the Fieldbrook, and now we have Fredonia, and the cases, as we've talked about before, have been in the single digits, and now you're seeing the double digits. Certainly, as you said last week, you're prepared. You've been prepared for this from the very beginning, for the most part, right? But still, how jarring is it to see now that once we were flying under the radar, and now we seem to be right in the middle of the whole bullseye? How jarring is that for you now, and why?
I think jarring is a word. It's been quite stressful. When you have 173 active cases, that's a lot of work for our public health nurses to have to manage. While we were expecting to see an increase in cases, with colleges reopening and with schools reopening, you always know there's a potential of something like a manufacturing plant, which we have had. And I have to commend again my staff for the job that they have done 7 days a week, behind the scenes and working with anyone who tests positive to immediately get them into isolation and do the contact tracing and working them with the state's virtual contact tracers to continue monitoring throughout that isolation or quarantine period. I find it is frustrating when outbreaks could be prevented, and so much of that goes back to just wearing a mask. And that probably is our single most important thing that we can do to prevent the spread of respiratory diseases. And I know it's not always comfortable and it's not always fun, but when you can't maintain 6 feet of distance, it really is important to have a mask on at this time if you really want to prevent COVID-19. And I understand the mentality of young people going to college. Most of us have been there. But this is a time for you to really step up and be a leader and be a good role model for your students that are around you. And I think, I'm hoping that these college students will realize they're role models for these college or these high school and middle school students that are now embarking, on a new school year. And it is important that they role model the actions that we want everybody to be taking right now. Nobody wants school to be canceled. Nobody wants to have to go to all remote learning. There are a lot of other concerns out there for all remote learning. We also run child welfare. And I can't sit here and tell you that I'm not really concerned about some of these kids that are in high-risk situations, and they need the socialization. We have children with learning disabilities who need to be in a classroom setting. They need to have more structure. We have parents who need to work. So all of us together, for whatever the various reasons are that motivate you to do the right thing and get us through this pandemic, now's the time to do it.
Thank you.
One of the things we've seen, and we talked about it this morning in my response team, is if you look at what's happened in Europe, it's been mitigated with wearing a mask and discipline. And it's unfortunate. We've done a good job, and sometimes we tend to, kind of become a little bit more lax. The interesting piece is the message from our office in the county has never changed from day one back in March. It's to be safe and be respectful, especially when the guidances were coming out. So we just, again, urge everybody that, this is still here. We still need everybody to have the same dedication and discipline we had in those earlier months right now as we're moving through this. And it's challenging. It's a very challenging time. But we need to continue that as we move forward, especially now with schools opening and other events taking place. And, we just need to be, do our best to continue what we've done in the past. Moving on, Dennis Phillips from the Post-Journal.
Yes, hi, PJ. My question's for Christine. There is a concern nationally that this fall and winter people might be infected with both the flu and the coronavirus at the same time. This is being called a twindemic. What can county health officials do to decrease the chance of a twindemic happening in the county?
First, I have to apologize, Dennis, because until I just heard your name, I completely forgot about your email that I promised your response to. So I can still get you something in writing on that. I really haven't heard the twindemic talk that much, at least not throughout our county health officials group throughout the state. We have had to put together a plan for flu prevention, which we do every year. This year, there's a COVID component that goes along with that. The role of the county health departments has always been disease prevention. So we are charged more so with outreach and education and immunization, more so than testing. We look to partner with the pharmacies and our healthcare providers to ensure that there is adequate vaccine, and also that the advertising is out there, the message is out there to try to increase our immunization rates. We also work with all of the school districts on general immunizations, vaccinations for children. This year that will be stepped up when it comes to influenza and COVID-19. There is a chance that people can be co-infected. Some research shows that, some say not so much. There will be, I anticipate, a significant amount of testing for both of those viruses this year, especially immediately this fall. I don't think if you come in with respiratory symptoms, you're only going to be tested for one or the other. I think you'll be tested for both. And that is important because there is Tamiflu and some other alternatives out there for influenza treatment that we don't have yet with COVID-19. The flu vaccine is going to be more important than ever. You need to keep your body strong. You need to get the proper rest and take precautions. And we've seen every year, even if the annual flu vaccine is not completely matched up with the strains that end up hitting us for flu season, some protection is better than no protection. So you're always better off to get that flu shot. And we're going to absolutely be pushing for the vaccinations this year to try to keep our population as healthy and strong as we can. All of these additional measures that we take with masking and hand washing and cleaning and disinfecting frequently touched surfaces should only help to decrease influenza and the common cold and everything else that's spread in those manners. So I'm actually really hoping that we can see a decrease in influenza this year. But there again, it goes back to how well we do our preventive measures.
Is there any concern about running out of flu shots locally if more people are receiving them this year?
I hope not. We really are not involved in the supply chain of a flu vaccine. In reality, the local health departments are usually the last to get any flu vaccine. That goes first to commercially, so it goes out to the pharmacists and the healthcare providers. We receive vaccine only as a last resort, or in a case that we were like back in 2009 in the H1N1 pandemic, where we had a larger role in a new vaccine against a new strain of the flu. I have not heard yet that there is any fear of a shortage of vaccine. Influenza vaccines are something that we've been making for a long, long time in this country. So that technology is there. That's what's so different about, the coronavirus vaccine. That it's a new vaccine for a SARS virus versus an influenza virus.
Thank you very much.
Moving on, Mr. O'Connor.
Hi, PJ. Hi, Christine. Question for both of you. You both have mentioned that the virus is in the community. When it's not going to leave the community, and so how long, absent a vaccine, do you expect that the mitigation measures, including restaurants only having 50% capacity, et cetera, is it now until a vaccine is developed, or is there a date certain when it'll end? Will we be doing this next year?
Wish I had an answer to that one. I think everybody around the world wishes they had an answer to that. We just don't know. I don't foresee the precautions that we're taking, such as masking and limiting capacity of indoor spaces, going away anytime soon. If a vaccine hits the market and we actually can do some mass vaccinating, I think we will be able to let up on our precautions and go to more, change the strategy to more protecting your vulnerable instead of protecting the entire population. Short of herd immunity, which experts say is probably 60 to 70% of your population would have to be infected, we're nowhere near that. The vaccine is the next best thing. As the weather gets cooler and more people are going inside, we have to be even more vigilant because of the airflow obviously is much different inside than outside. So I don't see these things going away in the near future.
To that point, I'd asked several weeks ago about continuing the phases, and that was denied. So, we wonder why. Is it because we don't know how long we would have to continue phases? And those are some of the questions people asked early on. I think as long as we continue to do the right thing, some would have argued, could we have looked at changing, limits in restaurants 2 to 3 weeks ago with our numbers into the single digits? Probably could argue we could have, but right now it's not even thought. It wouldn't be prudent. So we have to continually monitor this, and how long. I know there's restaurants that want to get back open. There's restaurants that aren't open because of the half capacity, and they couldn't turn the tables over fast enough to make it worthwhile. So those are all concerns, but it has to be done based on the health and safety first. And until those numbers show us we can do this safely, then, what we're doing right now needs to continue. And as we've seen, maybe we need to do a little bit more to make sure those numbers come back down to where they were.
So just to add that question, so this could go on for another year, another 2 years?
I hope not.
If you look at other places, I know we talked about it this morning, in where it was in Wuhan, the kids are back in school without masks. But that was a very disciplined maneuver, disciplined plan as they came out. In European countries, very disciplined. I know, my daughter was in the Czech Republic, and it was mandatory you wore a mask. And if you weren't, you'd be, there were fines or the police would be talking to you. So different philosophies and different, different societies. But we just need to make sure that we do have a lot of freedoms in the United States, but we need to exercise the freedom to protect one another. And the faster we can do that, the more responsible we can be to keep these numbers low, the quicker we can get back to, a normal life. But nobody has any idea when that's going to be.
But I think it's also, we've learned a lot, since, let's say, February, March, when the virus really took hold here in the States. We've learned a tremendous amount about it. And that is helping our response and helping our actions. It's improving the mortality rate for those who do get COVID-19. I think, that's happening on a daily basis by researchers and experts at all levels. So I think the more we learn, obviously the more you know, the science should impact our policy. So as we continued through this time period, if we were able to relax procedures or protocols based on the science, I think that will happen. But right now, we're not there.
Second question. You both have mentioned gatherings, particularly those in SUNY Fredonia. Last Sunday, I was at a gathering, the Jamestown Justice Coalition. There were more than 100 people there. Sheriff Quattrone was there. There's going to be another gathering, the Love March, planned for this Sunday. Why are those gatherings okay and the gathering of, say, 50 people not okay?
It's a challenging question, but we need to, I guess, to use the term, if you're doing the Love March, it's a love for something. You really need to have love for your fellow residents and decide whether you need to be there in a group of 50 or more. I don't think anyone's giving them permission to do that. I think, as we know, that brings along a whole host of issues and concerns with constitutional rights to freely assemble and to do peacefully demonstrations. So we know that there's an issue, a great issue with that. The question or the urge I have is my response is to please think about what we're doing. I understand your concerns. I understand what you're doing this for. But realize that we are in the midst of a serious crisis, and we do have an increase in numbers, and we need to keep those numbers down, and we need to, adhere to this social guidance as much as possible.
I think, and if you get beyond the numbers, you really have to look at the actions. If people are staying away from each other and they're wearing masks, I feel better about that than I do, let's say, young people having a party with 30 people there, and it's under the 50 limit, but nobody's got a mask on. They're all on top of each other. You're sharing drinks. You're sharing e-cigarettes. You are completely mingled on one another like there's nothing going on in the world. That's a much different scenario than if you've got people that are acting responsibly. And I'm not saying everybody today is acting responsibly, because that would be a stretch. But I do think that does make a difference in the way, like Sheriff Quattrone and our local law enforcement has looked at some of the things that are happening. We are in America. We do have a right. We have a lot of rights, and we need to be really thankful for those rights. But we all have to work together to preserve them and to keep ourselves healthy.
Couldn't the kids of Fredonia say they're peaceably assembling?
If you're mingling within 6 feet of one another and you're not wearing any masks and you're sharing drink containers and you're sharing electronic cigarettes and you are not abiding by any of the community mitigation efforts that we've put out there, then you are not being responsible.
Thank you.
All right. We'd like to thank everybody again for attending and those of you who called in. If there's anything more I can reiterate is we must step up our efforts. We must do what is asked. Wear your masks. Socially distance. If you are having a group gathering, consider the size. If there's one that you feel is too large, don't attend. We have shown and we've demonstrated, the residents of Chautauqua County, we can do this. We need to focus, we need to get back on track, and we need to demonstrate that we are looking out for everyone in our county. Remember, stay healthy, stay safe, and continue to be, throughout this pandemic, CHQ strong. Thank you.
All right, Chautauqua County health officials providing their COVID-19 press conference update following a week of an outbreak in cases here in the county. Thanks for joining us here for WNY News Now special coverage. I just want to recap, in case you're joining us, what we would discuss today. 50 new cases of COVID-19 here. 4 rapid testing machines are on the way to the county from the state to help test folks there in the northern section of the county. And officials remain concerned with an outbreak at SUNY Fredonia. 50 cases at the college reported right now. And the numbers have what they're looking at now going in a better direction, where officials believe that students are finally taking this seriously, wearing their mask and practicing social distancing. And Chautauqua County Executive PJ Wendell, a really big point he had today was, as we approach this Labor Day weekend, he's urging those in the community to please celebrate the holiday, but remember the social distancing, remember the masks. That's the biggest thing that county officials pushed today at their press conference update, is that the only way that we're all going to get through this pandemic is by wearing your masks and respecting one another. And Chautauqua County Executive PJ Wendell has been a very big opponent of that and really pushing that since the pandemic started. News continues 24/7, WNYNewsNow.com, and on our mobile app. I'm Justin Gould. This has been a WNY News Now special report.